Basically, I am responsible for providing crisis services in the community. And even with COVID, we are able to go out in the community, taking all the precautions to make sure individuals are getting the proper services, which has been key during this period of time because a lot of individuals have lost contact for whatever reason with their therapist, with their provider, or they're afraid to go anywhere uh, just to get the services. So the Department of Mental Health has really worked very, very closely with all our clients through the different systems to make sure they get services. So we do provide services in person, limited, of course, because of COVID-19. We do provide services through telemental health and the field services, which is the psychiatric mobile response or the co-response model that we have with law enforcement for those individuals who appear to be more combative and may need additional support from police. But the primary work in the field is through the psychiatric mobile response team, which is a behavioral team that goes around the field, does a lot of gathers a lot of information through the telephone in order to minimize the contact in the community to avoid any type of exposure, not only for the family but for the clinicians as well. In addition to that, we have the access line. The access line, which is 1-800-854-7771. Through that line, through this COVID period, we have implemented the helpline, the employee wellbeing line, and the veterans line. So a lot of people can just have access if even if they speak with their therapist, with the mental health provider, they can also call 24 hours a day, 7 days a week to speak with someone. We have a large population of veterans that are in really high need, so they're able to reach anybody at any given time through our access line and through one of our lines to get services to speak with somebody that have similar experience to them. Similarly, we have the line for our employees and other services for our employees because COVID-19, as Anna spoke very eloquently, the impact that it has had in the community. It is a global pandemic, national and locally to us in LA, we're at the worst of COVID-19 or the pandemic, with the number of people that have been exposed, number of people that are positive, and the resources. It really has a great impact. So what is the impact of COVID in mental health? Mental health is one of the greatest assets that we all have. Unfortunately, oftentimes we primarily focus on our physical component. For example, if we have a headache, if we have a medical condition, we immediately seek assistance because we know that it has to be taken care of. And once we seek assistance, then the problem it's addressed, hopefully resolved. But what we have seen, an increase in individuals that are calling our line expressing that they feel like they want to die. And it's really hard because we don't have any data in terms of complete suicides. As of now, we're hoping to get some data in the near future. If it has increased, what we have not, it's that what we know, it's that the number of calls, the number of individuals thinking about death, it's increased. Some of the things that we know that they have increased, it's individuals experiencing depression, anxiety, fears, lack of insight, and really finding themselves in a crisis because they're having difficulties connecting with others. This impact has really, the impact of COVID, it's not only at a professional level, but it's also at a personal level, because we all have to, at this point, we all experience handling multiple things at all times. Again, not only at work, but also at home for those individuals who have children and who are in distant learning, Children are really trying to cope with a new way of living, not interacting with their friends, with the kids their age, and being in the house at 24/7. Uh, Parents trying to learn how to become teachers, how to teach, how to assist their kids. All of that causes a great deal of stress that oftentimes people are not able to identify what's going on. That's where mental health comes into place. We have had a lot of advertisements about mental health billboards with our 800 number. We offer services in all the threshold languages in LA County, and people are welcome to call at any given time and request services. There's also an increase in individuals using substances just to kind of deal with what they're going through, not really knowing that there is other alternatives, or that the problem that they're having is that their mental health has been impacted. Why in our communities, oftentimes mental health is seen as a stigma. Mental health, it's seen as a problem that if you say you have a problem with mental health, it's really not addressed as easily as the physical component. So I will advise everyone to really start talking more about mental health. Without our mental health, we really cannot concentrate, we cannot focus, we cannot function with our kids, with our families, we cannot function at work. And some of the symptoms that we can begin to recognize, it's when we're irritable, or we're feeling down, and it's a constant. We're not sleeping well. We're having, some fears that we didn't have before. The fear of something is going to happen, but we don't know what it is. If you are looking for other ways to deal with your stress, such as eating more or sleeping more, or drinking, all those are symptoms of our mental health, and we're trying to cope with mental health in the best way possible. However, there's individuals out there that are not able to seek the assistance, or not familiar with what's available to them. So I really will encourage everyone to look for the services. Again, mental health provides outpatient services, face to face, in all the threshold languages in LA County. We don't ask for insurance. We don't ask for immigration status. We provide services to anyone that comes to our doors. If they don't want to come to our clinics or seek services in person, they can call our 800 number, where they can speak with someone. They don't have to release their name. They don't have to provide any identifying data, but just ask to speak with somebody.